Wave, Lindsay.
Trying to be sociable.
Oh, yeah.
Hey, isn't it your birthday today, Lindsay?
Mhm.
Nice day for
birthday,
birthday.
Lindsay.
I'm canceling. I'm picking a new day.
Happy COVID birthday.
Thank you.
Happy birthday, Lindsay.
Thank you very much.
Did you buy a new Corvette for your birthday?
Nope, that's my 42nd birthday. I've got 3 years.
Okay, I'll be looking forward to
My second 21st birthday.
it.
I have no idea what's going on with my video. You guys, no idea at all. So
We can hear you, but we can't see you.
I just get my name because it's not working.
And I'll remind everybody that we're going to be live here in a second. So
Commissioner Cruz, can you see everybody else? Will you be able
Yeah,
to see?
I can see everybody. I just
Okay.
I even got all pretty today. Just kidding.
Tony, wherever you're at, I think everybody is assembled. So
We are live. We are live.
thank you, Tony. Okay, welcome everybody. We are to our February 16th staff meeting. It's 9 o'clock today on Tuesday, February 16th. We are doing this as a Zoom call, basically because of all the challenges with the weather that we all are very familiar with. I do know that I'll just make a comment. I believe Evergy's having a press conference starting right now as well. And we have somebody, one of our persons in communications or somebody's going to be watching that closely, and we'll allow them to interrupt us to give us update if there's any information that we can, that the commission needs to know and the public needs to know. So with that, I'll turn over the meeting. Again, welcome commissioners and support and staff to joining us on this Tuesday morning, and those of you in the public that are watching on YouTube and Facebook. So good morning, everybody, and I'll turn this the staff meeting over to Tom Stoltz.
good morning, Chairman. Thank you for the introduction, and thank you for reminding us about the Evergy news conference. As you all know, we had received information from them early this morning that there would be again, because of use and demand in the extreme cold, the rolling blackout phenomena again today. So everybody should plan accordingly for that. Just for those watching it, in case they didn't pick it up yesterday, the target for that is a 30-minute rolling blackout to just make sure there's enough power and they don't go into what's called uncontrolled blackout. They're trying to maintain control of this. It could take up to an hour. If you do have a power outage and it's part of the rolling blackout, there's no need to call. If your power does not go back on within an hour, I think they recommended yesterday to give them a call. Then it's probably a switch that's frozen or something that can be remedied from the field. But when they do the blackouts, they have field crews in that area to promptly get those things back up and running. So we'll just have to live like this today and potentially tomorrow, and then hopefully when the weather lightens up at the end of the week, it will back off. Today we have just one topic, Chairman and Commission. We're going to talk about the vaccine rollout. There's many moving pieces to it again this week, and we're going to have many speakers today. I'll start us off by giving a recap of the hospital call yesterday for the public. We have changed our website now to reflect the new numbers and the new data that we got yesterday. It was probably the best call on the hospital we've had since October. All the numbers continue in the right direction. The patient population is down to a more reasonable level, and the ICU population of COVID patients is more down to a reasonable level. Both doctors at the hospitals, Dr. Ebersol and Dr. Antonios, asked that we turn the indicator to green on the dashboard. They are now back to within more of a normal operation within our hospital system, and that of course is really good news to go along with our 5 to 6% positivity right now. The numbers continue to move in the right direction, and hopefully now, and we have a little bit of information. Adrian will provide us with a little bit of information late about the only bad news of yesterday regarding COVID was we have the UK strain now in Sedgwick County, and we'll talk about that a little bit at the end of the presentation. I had asked that we let the presenters all go and finish, because we're going to try to be as comprehensive as we can, and just jot your questions down or your comments down, and then Chairman, you could manage the Q&A at the end of the session. But Tim will start us off and kind of just go through the vaccine statistics. Kate will try to get a PowerPoint up if she gets the freshest numbers from Seth here. And then he will talk about what the scheduling is for this week and who our population is for vaccinations. Adrian's going to go into some detail. I know several of you had gotten calls along with me about the 259 vaccine rollout on Friday. Adrian's going to give us a thorough explanation of what happened there, and a little bit of miscommunication that happened there that we're going to try to resolve and hopefully not repeat. She will explain that situation. While Adrian has the podium, she will also talk about some staffing challenges and kind of what the plan is regarding getting vaccinators down to the mega site to administer to as many people as we possibly can. Then Seth Conkle is going to talk about the future of vaccine transfers to community providers. And a community provider, for example, is 259. Mays and Derby school districts are lined up for that as well, in addition to several pharmacy partners, Dillon's and Walgreens, some Ascension capacity, and he will talk us through how these vaccines will transfer over and what the future looks like. And we chatted yesterday a little bit, and it could begin as soon as this week. So Seth will give us an update on that. We will also talk about, Tim and I will kind of talk about the future of vaccine populations, where we're at today, where we think we're going to be going in the future, and we'll talk about things like when we can get to over 65 and when we can get more comprehensive with teachers and public safety, and kind of talk about the comorbid population that the commission had brought up last week. And then Adrian will conclude with what's going on with the UK strain, what that means for us, maybe what some of the doctors are saying, and then we will then do question and answer. So with that, it's a lot. We'll have some audio or some visual tool to go with that. But if you just please hold your questions to the end, and then we will do our best as a staff to try to get you totally up to speed for today. So Tim, I will turn it over to you, sir.
Okay, Kate, if you'll advance that slide. As the numbers reveal themselves, I think the last number is 30,000, but last week we vaccinated 5,934 people with their first dose, 2,540 received their second dose. And so that's a total of 8,400 doses last week, and we've got 30,365 cumulative doses dispensed so far. And so we continue to make progress. We've got a lot of folks working at the 2 different sites. We've had to reduce some of the appointments at the drive-through because of the weather. The weather has really put a lot of strain on the system in terms of getting folks vaccinated. Both Saturday and yesterday, very busy days at Interest Bank Arena. We had to reconfigure some things on the fly to make sure that we got people inside so that they were safe as they waited their turn. And we've had to reduce some of the appointments that we have available at the drive-through because of the weather and the conditions that we're dealing with. But hopefully a week from now, the story's going to be much different weather-wise, and we'll be able to open things up a little bit more. Kate, do you want to go to the next slide, please? I'm going to cover this first bullet point and then turn it over to Adrian after that. But we are scheduling right now for the age 70 and older and healthcare associated workers. And we have, early this morning, it looked like we had about 930 appointments left. I know that some of those have already filled throughout the course of the day, but we do have slots available throughout the course of the week for folks, either second dose or first dose. So I encourage people to go look. The other challenge that we have continued to experience is people that are coming for their appointment much earlier than that 15-minute window that we're hoping for. And particularly with the population that we're serving now at Interest Bank Arena, it's not uncommon for an individual to bring someone with them to help them through that process. And that really impacts our ability to get people indoors and keep them distanced and safe inside rather than out in the cold. And so, again, I'd encourage people to come not more than 15 minutes before their appointment. If we schedule an appointment for you, we have a vaccine dose reserved for you. So we want to make sure that people understand that they don't need to get in line hours early to make sure that we don't give their vaccination away to someone else. We're very careful about making sure that the vaccine that we schedule, that there's vaccine to back up that appointment that we schedule. And so again, for people's safety and comfort, if they could come 15 minutes beforehand, it's going to make the process flow much easier. And I think that covers what I had in mind. So I'm going to turn it over to Adrian to let her talk a little bit about our first experience with vaccine distribution and what worked and one of the challenges that we experienced too. So Adrian.
Good morning, commissioners and Board of Health. Adrian Byrne, Health Director. So it's always been our plan to redistribute into the community. And there are numerous pharmacies and clinics, and USD 259 is the only district that went through the paperwork and the process with our state health department to become a vaccine provider. And if you're a vaccine provider, that means that we can transfer vaccine to you, and whoever we transfer a vaccine to, they're then responsible for the data entry, the paperwork, vaccine totally. We can still redistribute to people that aren't a provider, and that means that we're responsible for the paperwork, the data entry, and the vaccine. So staff went through the provider list and called everybody on the provider list to find out, why they signed up to be a provider, because some signed up to make sure that they could have their staff vaccinated, and then others wanted to be able to give to the community and or their patients. So we started with the rollout on Friday, USD 259, that it was our first rollout because they had the refrigeration, they had everything they needed to be able to store vaccine, and had been ready and were an approved provider. So the whoever we roll out to know that it's 70 and older, that they need to stay where we are. There was some miscommunication, misunderstanding, and so they thought 65 and older. That has been corrected since that time. They were to have clinics this week where they were going to vaccinate 65 and older. And as of Saturday, when I spoke with the nurse coordinator, the decision was that they were willing and totally ready to cancel those clinics because it just doesn't it's not worth their time to get all their staff together when it's just 70 and older. So at this point, they are waiting until we get to 65 and older, and then to all teachers. So there was no ever any plan on favoritism or giving someone the ability to do something that others weren't. USD is just part of one of many partners. We have pharmacies that we're going to start rolling out to this week and getting that solidified. And we're working with the federally qualified health centers and other community clinics to distribute or transfer vaccine to them. So it's all part of the long-term and short-term plan so that we can get more vaccine into the community and have more access points. And I'd be happy to answer any questions.
Adrian, let's keep going now with
Okay.
staffing challenges, and we'll come back and. let
Okay.
Commissioner-
Oh, okay. So staffing challenges, it has been quite a challenge for staffing. We are using a lot of temporary agencies, and the challenge with temporary agencies is that a lot of the nurses they work full-time jobs, and so they're working through the temporary agency on their day off or on the Saturday. So we have been able to schedule three days in advance. We know exactly how many what we're going to have, and at this point, our plan is just to always have more than what we need in case someone cancels or isn't able to work for us on during those days or week. So we know we're finally at that place where, and our goal is just to keep it consistent, where we know we are going to have vaccinators at our drive-through site so they can cycle in and out, during the cold and not be out there all 8-9 hours or longer. And same thing with interest, to be able to give staff breaks, but also just that we have as many vaccinators as we can so we can move people through the clinic as quickly as possible. So it has been a challenge, and I think that we have finally engaged more and more temporary services that we weren't even aware were out there, where the medical staff has been our biggest challenge, but we are sitting good at this time with the amount that we just have coming in every day.
Thank you, Adrian. Seth, you want to take us through the transfer to partners and?
Yeah, absolutely. So, Seth Conkle, helping with some planning efforts for the health department, previous county employee over emergency preparedness at the health department and epidemiology several years ago. So just kind of a plan in terms of distributing or transferring. So we would be looking at the providers who have been signed up through the state. And when we kind of look at that, we have 86 non-pharmacy partners that have signed up. We have 80 pharmacy partners who are eligible to receive the vaccine. And then we have those who have elected to sign up. So the people who have signed up make the process for the health department easier to transfer the vaccine. So what we do is we simply transfer the doses. That means that those providers are responsible for administering, documenting, keeping track of the temperature. Basically, at that point, Sedgwick County no longer has responsibility for doses. And then there are partners who did not sign up for a variety of reasons or were not approved through the state system to providers. It doesn't mean that they don't qualify to administer. They may just not have had appropriate long-term storage capabilities for them. But if they have the medical staff, we can still use them to actually dispense or administer the vaccine. So as Adrian indicated, USD 259 is really, I think, the only one that's signed up as a school district, but all of the other school districts in the county do potentially have the medical staff and their school nurses to help us administer the vaccine to their teachers. And when we get to that point, possibly to their students. So as we look at that ability, that provider network within our community, we do want to start utilizing that. The vaccine has been coming in slow, as you know, and we've been able to kind of administer that and keep that within the health department. But as the vaccine continues to grow, we want to be able to activate those providers. So the federal system for the pharmacy side started last week, and we do have pharmacies in the community that are administering vaccine through that program. We do intend for those vaccines to increase over the next couple of weeks and continuing on throughout this response effort. But we, the health department, intend to give those providers who meet the criteria that we need them to meet vaccine. We will see a majority of that, or a lot of that, going to the pharmacies. Some of the clinics, like Via Christi, are on that list of those providers who at this point have signed up to administer to their staff. Or we have doctors' offices who signed up to administer to their staff. So not all of those people are currently viable candidates to receive the vaccine, because potentially we've already passed their phase. But for anybody who still has patients or staff who maybe aren't vaccinated and do fall into later phases, we will be looking to distribute, or in this case, transfer vaccine to them to allow to vaccinate. Included in that subset are our federally qualified health centers. So those that are like Hunter Health, that are under the Indian tribes and the Indian nations, they have a stream that they're getting directly from the federal government. And we're seeing that the federal government is going to start setting up a allocated federal stream of vaccine that can go to those federally qualified health centers. So we will be looking at what they're getting through that system when that gets rolled out later this week and into next week, and then also what their throughput capacity is, and then what the health department can give to them to administer in the interim, or on top of their throughput that isn't provided by the federal system. So I think for now, Tom, I think that's all I have.
All right. Thanks, Seth. And then I think this brings the discussion to kind of what the future will hold here. As Tim mentioned in his presentation, we are administering to 70 and above right now, and that's across the board, including what 259 is doing with their teachers. The next logical question, I think, that we will be looking at this week and visiting with Dr. Mins about is, when can we move that number to 65 and above? And when can we become more comprehensive in teacher and staff and public safety kinds of vaccinations, which are the next up in queue in phase 2 that Dr. Mins has lined out for us. So it's interesting that we have some appointments available yet. We're kind of just doing this a little bit by feel. When we're not filling appointments, just like last week when we were at 75 and above, we just ratcheted the portal down to 70 and above and quickly filled appointments. So we'll have that discussion through the week, depending on how our appointments go. And it's so difficult to determine what's going on with the population, because I think so much of it has to do with this weather. I think if it was 50 degrees outside, this may be going totally different regarding how fast we can move and regarding the number of signups we would get. But when it's negative 12 outside, and some our population we are serving right now is elderly, it's very difficult for them to negotiate that. So I think that we'll see how the week goes. It is supposed to get warmer later in the week, but at the same time, we want to continue to put as much vaccine out as possible on a daily basis. And if you're looking at the numbers, it will go from 1,000 a day to 1,600 a day. We're a little bit slower now just because of the weather, but we clearly want to continue. We'd like to get up to a 1,500 to 2,000 dose per day from the mega site. And then, as Seth alluded to, get a number of community partners going where we could move this more quickly. Tim didn't mention it during his presentation, but we have some indication that Pfizer is going to have difficulty shipping this week. I don't think it's a surprise, because this is national weather going on. They're getting beat up pretty good on the East Coast with this as well. So it's possible we may not get a shipment this week, but with what we have on hand, we feel confident that we'll be able to get through this week and next week with vaccines in hand. It might hold up Seth a little bit on transferring to partners if we're not seeing vaccine coming in, but we feel comfortable honoring every single application, or every single person that signed up to get a vaccine will get one. We have a dose for them, so there doesn't need to be lines or panic. And that's been our goal from the beginning too. It's probably a good time right now. I do want to talk about the UK variant. I want to have Adrian talk on that, but it's a good time maybe now for questions from commissioners. This is really all of the logistics discussion we have for today. So Chairman, I will let you facilitate the questioning, and we'll try to do the best we can to answer.
Okay, commissioners, yeah, let's raise your hand if you've got one. I'm trying to see. I know that David Dennis has a question, so David, please go ahead.
Thanks, Mr. Chairman. Thank you, Manager. I appreciate the information. Let me preface my comments by saying that I've been an advocate all along to make sure that our teachers get vaccinated, because the most important thing that we have is a teacher in the classroom. I'm not excited with remote learning. We need to be able to get the teachers back in the classroom. But that being said, I was very disappointed on Friday evening when I received, when I was watching the 9 o'clock news on the TV, and found out that we'd transferred at that point, I was told by the TV, 2,400 doses to USD 259. That brings up my first question. They also said when they transferred 2,400 doses, they were going to give 1,200 doses and bank 1,200 doses. And I've been under the impression all along that we do not stockpile doses, that we put doses in people's arms. So what my question is, are in fact we stockpiling doses?
Tim, I'll let you go. Yeah.
Okay. The doses that we transferred to the school district were doses that we had received from one of the local hospitals. Their allocation was greater than what they needed. And so we got just over 2,400 doses of Moderna. And all of the vaccine that we're receiving from the normal allocation process now is Pfizer. And so when we have two different vaccines, it makes it more difficult. It doubles the amount of pharmacy space that we need to do and that sort of thing. So when we had this gift of this transfer of vaccine from one of the hospitals, it was Moderna. And so from a logistics standpoint, it makes sense for us to try and transfer that out to someone else. The school district has identified a need. They've identified a process to dispense. And so we transferred the 2,400 plus doses to them with the idea that that would cover roughly 1,200 people, because they need to give the first shot and the second shot. If they're able, and we know they have the freezer capacity to be able to store that, and so we can transfer that to them and they can manage that allocation for us. So I wouldn't say that we're stockpiling doses, but we're trying to be strategic in how we use doses at our vaccine clinic, and then how we distribute vaccine to our partners in the community. As if we see Moderna come in, it makes sense for us to transfer that to someone else and have them help us manage that, so that we don't have the two different processes going on in our vaccine clinic on any given day.
I think that's the key, that Commissioner Dennis, that was it was Moderna vaccine, and anybody here on this can correct me if I'm wrong, but our inflow of Moderna is, we don't know when we're going to get Moderna again, or if we're going to get Moderna again. Our flow seems to be Pfizer, and so it's prudent for the schools or whoever's distributing Moderna to hold on to a second shot for people, because we don't know if in the next month we're going to get any more Moderna. If it was Pfizer, we're more confident putting that out the door, because that seems to be our stream coming in right now. But we have no indication from anyone we're going to get any more Moderna. So that's kind of the explanation of that strategy.
Okay. The other thing that I heard from the news, of course, I'm not receiving any of this from staff, which I should be, but the other thing I heard from the news is that USD 259 was also giving the vaccine, and you've already answered, we're not going to give it to people that are under 70 years old, but the news also said they were giving it to staff members that had comorbidity. So is that true or not?
I'm going to let Adrian, because Adrian has the most contact with the school district.
So my understanding from talking with the school nurse coordinator was that the only misunderstanding was thinking it was 65 to 70 that they could include, and there was no conversation about there being any comorbidities.
Okay, well, that's what the news is reporting. So last week and every week, every one of the commissioners have to answer to the community. That's our job, is to answer the community. We're the ones that are elected. Last week, I had a number of folks that were very upset with me because I told them at that point in time, we were going down to 75 years of age, and we had some people with comorbidity that were 74. So when we put information out, I want to make sure that we're accurate. We owe the public the responsibility to give them accurate information. And when I respond back that no, this is our policy right now, but I hear on the news that there's a different policy, I have a little bit of a problem with that. Another question I've got, I understand from your discussion that USD 259 has put in and asked to be a provider. I've also heard from a couple other school districts. We have 10 school districts that are headquartered in Sedgwick County. And we need to make sure that each of those 10 school districts have an opportunity to vaccinate their teachers. I've already heard from a couple of them that are not happy that we are only looking at USD 259. The other problem that I see with us only looking at USD 259 is the majority of their teachers are teaching remotely. And I have school districts, I know in my district, and I'm sure that other commissioners have it in their district, that have had continuous learning from the first day of class way back in September. I think that we owe it to those school districts that have continuous learning to make sure that we keep their teachers healthy. So I don't know how we're prioritizing, because I'm not getting any information unless I watch the 9 o'clock news to be able to get that. So if you think that I'm upset, absolutely, 100% upset. I do not believe that staff is keeping the commissioners informed. We're the ones that are ultimately responsible for the public. We're the ones that get the heat. We're the ones that are responding every day to the public. And if I'm not providing accurate information, then I've got a problem. And if I've got a problem, staff has got a problem. So I just want to make sure that you understand that I am totally upset with the way that this leadership has been moving forward. I want to make sure that we get it out to the public. I want to make sure that we get it out to the teachers, but please keep the commissioners informed. Thank you.
If I may respond to one of those comments, Commissioner Dennis, we have called a handful of the schools, the other districts, and last week, and they were finishing up with the other ones today. So there was no, it's always been a plan to reach out to all to see if they wanted to use their nurses for some sort of a in-house vaccinating, or whether we could do a joint vaccination clinic with them, with going on site. So all of those things are in the process of being discussed and planned.
Okay, I think, Sarah, did you have your hand up, or were you?
Yeah, I have a couple of things real quick.
Okay. Commissioner Lopez.
Thank you. So I do have a question. We talked about nursing students last week. Is that a possibility? Have we looked into that further to see if nursing students can help, with our volunteer base, if they would be able to do vaccinations?
We have. It was about a month ago, maybe 2 or so weeks ago, that Newman University reached out about being able to use their third year students. And so we are in contact with them and others. And so, yes, we are turning over all those stones to get medical staff in our clinic.
Okay, perfect. And I had another question about that as well. I know that we have a lot of retired nursing staff that might be under this age 70 threshold right now. but because they're retired, but they were nurses, would they be able to get the vaccine if they were going to volunteer to give those out, after they got their full 2-dose vaccine?
So anyone that volunteers, regardless of where they are eligible to receive the vaccination or the vaccine because they are working with the public.
Okay, perfect. Thank you. And then, so for schools, I've been talking with USD 259 specifically. I have reached out to my other districts in my district too, but I have been really impressed with what they've done. They took the initiative to get approved to receive those doses and be able to do them themselves. They've also put together a really comprehensive plan of how teachers are going to go. They put a survey out to everybody to see how many people would even be interested in receiving the vaccine, and they have a 3-tiered approach to their staff of who's going to be the most high risk to the lowest high risk. So special education teachers are obviously going to be at a higher risk than maybe some others are pre-K teachers and that sort of thing. So I think we could really use the modeling that they've done to go into our other school districts to see really how we could make sure that we're prioritizing the highest risk within our staff at schools. So I'm really happy with what they've been able to do and hope that we can kind of use that modeling in our other districts as well. But I do wonder, when we talk about vaccinating our teachers, are we also including our bus drivers or maintenance or admin staff? I mean, is that everybody that's going to be included? Because, they're all with these students day in and day out.
Yes, it's like the healthcare associated workers, where it wasn't just the physician or the nurse. It could have been the janitorial or dietary staff. So they will be included.
Okay, perfect. And then, oh, sorry, go ahead.
I would add, Sarah, bus drivers, all the support function staff of the school systems are included. When we use the word teachers, it really means everybody associated with providing services, maybe the cafeteria workers, everybody.
Okay, I had a few questions on that, and I figured that was probably the case, but I wanted to make sure that got out to everybody. So I do have a question on the 2,400 doses that went to USD 259. If they have the ability to give 1,200 of those, and those are going to be for that district and for the staff at those schools, are there 1,200 people over the age of 70, or are we making them hold on to those? Even though they're going to be going to their staff, do they have to wait until we drop our numbers down? Because I guess I don't understand that. If they have the vaccines with them, we know that it's for them to use for their staff. Why we would make them wait?
One of the reasons we're doing that is because we're trying to be equitable across the community and follow Dr. Minz's directive. And his directive has been, as we work through the ages before we work with occupations. And so that's primarily the reason that we're taking this approach. And the request that we've made to the schools is that they follow the guidelines that we have for the rest of the community. It's the same request that we are making of our other partners. If we're going to transfer or distribute doses to them at a pharmacy, for example, we're asking them to again follow the guidelines that the rest of the community follows. And we know that we're moving through the age progression a week or two at a time. So fairly soon we'll be prepared to talk about age 65 and above. And then after that, we start working with occupations. And we're going to ask everyone that we distribute vaccine to follow the county prescriptive as Dr. Minz lays it out for us.
Commissioner Lopez, that is a discussion I think we will have with Dr. Minz this week. To your point, that we should maybe consider, and as Tim said, it's really about being fair and equitable to the other school districts right now. If we do move that direction and Dr. Minz would okay, for example, all teachers going through vaccination, we want to make sure that we can accommodate the other districts within the county as well, so they have a fair equitable opportunity to get vaccinated as well. We will be discussing that with Dr. Mintz.
Okay, perfect. And then if we are looking at the other districts as well, are they going, I guess, can they, and how hard is it for them to get approved to be a provider through KDHE? Would that be easier if each district had someone that went through that, or would it be easier if we just partnered with them? Or I mean, logistically, what's going to be the easiest way for the surrounding districts to be able to vaccinate their staff as well?
Probably, go ahead.
Well, I think that we'll work with each individual district to figure out what makes sense for them. Some districts are going to be small enough where it makes sense for them to maybe send their folks to our vaccine clinic. Others have the numbers and the staff help and support to do that. The big difference between an organization that goes through the KDHE approval process and one that doesn't is the amount of work that the health department has to do on the front end and the back end. If they're approved, like 259 is, we can transfer the vaccine to them and then they become responsible for all the reporting and that sort of thing. If a school district, for example, doesn't go through that process, we're going to continue to work with them and we'll figure out how we can utilize their staff maybe for the dispensing, but we'll be responsible for tracking the dosages and getting that data entry done and that sort of thing. So we're going to individualize it to the school district and make sure that what we do makes sense for them as well as the health department.
So when we open this up past the age of 65 and we open it up to schools and we're saying that teachers can now come in to get vaccinated, are we going to make that so like a Saturday is going to be available for school teachers to come in because they're not going to be able to leave their students in the middle of the day on a weekday? So are we going to work with them on making sure that Saturdays are open and available for them to come in?
We will, and we'll have those later hours as well available for school staff.
Okay, perfect. And I just have one more question, sorry guys. But if we don't know how much Moderna vaccine we're going to be getting in the future, how are we going to be able to get Pfizer to our, community partners? Because I know that's the one that's so hard with the temperature and everything else that it has to be within. Logistically, how hard is that going to be going forward? That
cold storage requirement does complicate things a little bit. It may mean that we'll have to only allocate a day or two's worth of vaccine. So we really have to have some conversations with those other partners that are going to be doing the dispensing on to make sure we understand their throughput so that we don't give them more than they can reasonably give out in a period of time that meets that cold storage requirement. So it may mean rather than being able to give someone 2,400 doses to manage over time, we'll be able to give them 50 or 100, and that'll get them through 2 or 3 days, and then we'll have to get more to them. But again, we're going to have to individualize all of this to the provider and their capabilities.
Okay, thank you.
Okay, sorry about, I understand that Commissioner Cruz has a couple of questions, comments.
Thank you. I'm sorry my video isn't working. So back to both Commissioner Dennis and Commissioner Lopez addressed vaccines on shelves. So if we sent 2,400 vaccines to our school district, but we're not sure that they have that amount of people over 70, are those vaccines being shelved?
They are storing them. They're dispensing them and then they're storing them for future use. As Adrian mentioned, they've surveyed some of their staff so they know how many staff they anticipate vaccinating. They anticipate vaccinating well over 2,400 or the 1,200 that this would represent. And so we'll continue to work with them as we work through the age progression and then get into occupations.
Okay. And then Tom yesterday sent out an email. He says, I'd like for someone to address the status of when we can expect more vaccines from the state. He said the 80,000 received by the state did not seem valid. Can we have someone address that?
Beth, you want to go ahead and talk about the status of the 80,000 or what we're hearing or not hearing on that?
Yeah, absolutely. We are checking into that and confirming those. I think those were actually first and second doses coming in last week. So kind of divide that by half. We're actually looking back closer to the 42,000 doses we had been seeing previously. So I would think it was just a different way it was being reported through those press conferences, and that is where the issue lies.
Okay, so on the KDHE website, on their vaccine page, about, I don't know, three-quarters of the way down, it's giving the dosage per county, but it's only listing it per week. Is there a way to get a historical trend, how many vaccines they're distributing to what county per week? Because it seems like there's some sort of disconnect between what we're getting and what's being reported. And I want to make sure that if we're being held to a reporting standard, that everyone is being held to a reporting standard, so that we know how many are coming into our state that are being distributed to whatever county.
I do know that is being worked on at the state level, and hope to have something out very soon, as soon as the next couple of days at the latest.
Okay. So Commissioner Dennis mentioned this, being communicated to by staff. I wonder if, what is the expectation as far as updates from our staff? Will it be on Tuesdays only? I mean, I just want to make sure I understand the expectations, because I have received a ton of questions, and the last thing I want to tell my constituents is I don't know. And it is, I'm getting hammered by people. And I just want to make sure that I'm giving accurate information to the public, because that's who I answer to. So what is the expectation of when commissioners will be briefed on this information?
Well, Commissioner, I've jotted some notes what Commissioner Dennis was talking to. Staff needs to communicate as best we can in a time where there's just a lot of moving parts. It's almost going to have to go to a daily, because if we rely simply on this weekly, there's too much that happens late in the week, and then we end up with you guys not being brought up to speed. So we're working on, I sent you over the weekend this one pager with basic data on it, kind of keeps you aware of who our community partners are, and how we're going to begin administrating to them. I don't know that that's good enough either. I don't know if we should go to a 2 or 3 time a week staff setup to where we can have this kind of discussion. But we'll work on communications. I understand it's important to you. I think to some degree what unfolded with 259 caught all of us a little bit. And sometimes you tell providers information and they miss here, or there's a miscommunication there. That was not the intention of Friday, and I think Adrian did her best to explain that. We have multiple meetings as a staff every day, so I just need to figure out whether it's getting you all on every other day, or if we can get this one pager, this data that goes out via email up to a level that to where you're able to answer questions. Some of these, like today, I don't know until we consult with Dr. Menz. For example, if we want to start vaccinating all teachers, that is something we need to, there's a lot of moving pieces to that. We want to make sure that we're fair and equitable. We want to make sure we have the vaccines to do it. We want to make sure that we can accommodate those districts that don't have the capacity, like 259 maybe does, or some of the larger districts, that they can come into Interest Bank and get these vaccines at an hour and a day that is conducive to them. So there's a lot of moving pieces on those kinds of things. So sometimes we get asked questions during the day where we really don't know. We're still working our way through that. And that's just the nature of this, this virus, whether it's testing or PPE acquisition and now vaccinating. It's moving very quickly. Things are happening that it was impossible to plan for. We have 2 different vaccines rolling in, 2 different schedules of when they have to be revaccinated. There's second shots that go with all of this. It has to be kept in, refrigerated conditions. There's a lot of moving pieces to this. We will do whatever we can to keep the commissioners up to speed as best we can. And if it's requiring a meeting with staff every day, then we'll go to that. because the commissioners have made it clear that they want to be kept up to speed on a daily basis. So we will work through that as staff after this meeting and meet those needs.
Thank you. I appreciate that. My last question is about volunteers. I've had a couple of questions just about, is there a management of volunteers issue? Is there, what is it? Because I had a 20-minute conversation with a woman who has been doing managing volunteers for quite some time. So, I mean, could it possibly be that we have a volunteer that manages volunteers? I mean, what is a way that we can utilize volunteers to the best of their ability to help us out with the needs that we have?
We are making our way there. We have had a wonderful response to asking community members to volunteer, and we are making our way through that and plugging people in every day to positions. We're not going to always have an opening, but we are utilizing them in any way that we can. So we're going through the process, and since we've had such a great outpouring of people wanting to volunteer, we may not be able to put them into a spot right now, but we have someone full-time managing the Medical Reserve Corps. We brought in some assistants. So it is working at this point. It just depends upon, since we are engaging so many temporary services and we're getting this influx of medical staff, that we're just not going to always need to use those volunteers. But if we do, we will reach right out to them. And we are, at this point, just contacted some this morning to come in and help with logistics, with supplies.
Thank you for that.
You're welcome.
Okay, okay, thank you, Commissioner Cruz. All right, Commissioner Howell.
Thank you, Mr. Chairman. Appreciate the chance to speak. And I have a number of questions here as well. Let me just start with the schools, because I think that's the most recent thing we just discussed here. But now that the schools actually have this in their, has these 2,400 doses in their possession, if they're waiting for us to change or ratchet our age downward to get started on administrating those doses, that doesn't make sense to me. We're not, unless we're going to ask for those back and give them to someone else, and maybe that's what we're going to do, I don't know. But as long as those are in the school's possession and they're waiting for their age to ratchet down from 70, to me, there's no reason for them to be treated. Part of me says, I understand the issue of fairness and I want everyone to have equal opportunity here, but I don't know that we're going to ask for those back. So if that's true, I would ask the schools to go ahead and target their oldest staff, the 70 and above. But if they've already figured out how many doses that will take, and there's others that need that, if they have 65 and above, I'd like to see them move forward. So I'll see if there's any comments on that first. Go ahead. I have other questions as well. All right, if no one wants to comment on that, fine. I have a question regarding our partners. I'm sorry, Pete, I don't hear you. Okay.
No, I had no comment. I was just.
Okay, I saw your lips moving for a second. I wasn't sure.
I know, I see that. So I just commenting to myself.
Okay. I'm interested in are there partners that are partnering with Sedgwick County, if we work on getting them some vaccine, are they going to be held to the same strategic plan that we are following in terms of the ratcheting down the age and reserving this for people who are qualified under our plan?
That's our intent right now, but again, we're going to have conversation. We're going to continue to have conversations with Dr. Mins to help guide us through the process.
But Commissioner Howell, the direct question is, should they be administrating at the county policy? The answer to that is yes. We want them to, we want to stay on the same page, so we go through the community and serve the community as best as possible in as fair a way as possible.
I understand, the hospitals, obviously, anybody who's doing, hang on a second here. anyone who's doing vaccinations on behalf of medical providers, they have their own rules, and they're trying to hit as many people as they possibly can. I think there's a number of, congregate housing has an exemption as well, because they're under the phase 1A or 1B. But I guess I'm curious about, for example, I had someone contact me, I think it was a day or two ago, that said that they were a caregiver and they were not anywhere near age 70, but they were able to get a vaccine at Interest Bank Arena a couple of days ago. So I'm just curious how is that happening? As a caregiver, I'm talking about caregiver in their own home for their loved one. It's not, they're not a medical provider. So I'm just curious about the consistency of these rules being followed all the time.
If someone is a certified nurse's assistant or has some certification or license, then they fall under the healthcare associated workers.
I don't think they're a certified caregiver. I think they just are a caregiver for someone in their family as a family member. But maybe I need to go dig in and find out some more information. But I just wanted to find out if there's any awareness that may be happening, if it is happening. I don't know for sure, I guess. But I wanted to get into Interest Bank Arena just a little bit. I understand that I guess we're going to continue to use that for a little bit longer. There has been some discussion about using the old city library building. I don't know what the status is on that. Anybody like to update me on that? I should appreciate that update. But with respect to Interest Bank Arena, I had some people there in the last few days that contacted me, and they said that there are so many people inside that building that social distancing wasn't even a possibility, because there were so many people on the floor. Yes, actually in the concourse and around the arena, people were stacked up very, very deep, and they were not able to socially distance. And so, one of the suggestions, again, one of my understandings is, of course, people getting there. I think Tim Kaufman already talked about this. People are getting there way too early for their appointment time. I guess I just want to ask. We have 15,000 seats in that arena. Would it make sense for us to say to people, if you're here, for an appointment from this time to this time, you can get in line. If you're not in this window of time, please take a seat in one of these 15,000 seats until we call for your window, because number one, I don't think people should be standing up that whole time. And number two, I think there's no way to really straighten up that line. When people get in line and they're in the wrong space in the line, they don't want to change positions in the line. But there are people who get there on time and they have to wait hours as well, because there's other people who got there hours early that's causing other folks to wait. And so it's just logistically difficult. But I have to say, I do realize there's 15,000 seats in this facility. Why we wouldn't be able to use those seats to encourage a little bit of, I guess, different way of getting people in that line.
Commissioner, my comment would be that we'll certainly consider that. We'll talk to Interest Bank Arena staff to figure out if there's a way to make that happen. One of the things that we have, the two things that we've battled with most the last few days is the cold weather and making sure that we keep people out of that cold weather. So getting them inside, and then being able to manage the line that creates because people are coming early. And one of the things that we've certainly believed would happen, and we've learned to be true, is that people will not give up their spot in line. And when people come, they expect to get in line, even if they've come 2 or 3 hours beforehand. And they're not very open to going back to the car or to waiting elsewhere. I don't know how it would work for folks if we asked them to take a seat. That's certainly something that we'll discuss with our staff on site and with our partners at Interest.
Well, I would agree not sending them back to the car, which is my next point. I was going to say there's people who are obviously, they're elderly, and I think just by age, I would say that they are not someone that I would want to see walk for several blocks especially in these frigid temperatures. And so I'm concerned that, number one, I've heard, because there is so many people in that building, that the parking actually is a problem around the building. And some of these people are actually having to find parking spots several blocks away, and they're walking to the arena. And then when they get there, again, we don't want to turn them back, that's for sure. But I'm concerned about, I guess, the safety of these folks having to park that far away and then walking that distance. I think getting them inside the warm building would be the first key. But obviously, just because they're in the building, they ought to be in the actual the call line, if you will, for the vaccine. If they're there early, I think making or having them take a seat and wait for a time where there's the restroom facilities and there's a place for them to sit down, to me is it would be a much better way of handling that. But I don't know if we want to maybe consider potentially having some type of a shuttle, going around, maybe a remote parking lot that they could park in rather than having to travel a number of blocks to get to the arena. I just think right now, since there is a parking challenge, if we wanted to maybe ask Wichita to help us with some shuttles or something, I don't know. It's just a concern of mine, and I don't want to. I don't want to be critical of anything we're doing. I'm just aware of these other challenges that have cropped up. So I'm willing to listen to comments on that, and I have other questions as well.
Let me hop on just a second. So Commissioner Howell, to your first question regarding the schools, we will take that up with Dr. Minns this week. I want to make it clear that we value the other school districts within this county, and to greenlight Wichita 259 to do something that the other districts don't have access to is problematic for staff. So we want to make sure that we're fair and equitable to the other districts. We will be visiting with Dr. Minns and hopefully coming up with a strategy to take care of schools, but we want to talk strategically about that, what we have the capacity to do or not do at the arena, or through remote work with the schools so that we treat everyone fairly. So we hear you, but we want to talk through that before we just shoot from the hip on that. You also, since you brought it up, I'll mention it, the migration to the city library. We will put that out later this week in a press conference format. We do not want people to be confused about location. And just to repeat, we are at the arena all week this week. And if we can move to the library, we will announce several days in advance of that transition. That could also alleviate some of the parking issues that you bring up. And remembering that single-digit temperatures are not the forecast for the next 2 months. It's the forecast for the next few days. And by Friday, Saturday this week, we're back to a more reasonable temperature for state of Kansas, and hopefully we'll take away some of this danger of getting people in and out of whatever building we're in. So just to summarize, we are at Intrust Bank Arena all week. If the migration to the library comes to fruition, which staff is working on, we will press conference that later this week or several days in advance before we move. So we will keep the commission up to speed on that as well.
All right, thank you. And then I guess probably my final question, just maybe this is more of a comment, but I'm still interested in Dr. Minns' response to my call for comorbidities for people who are don't meet the age threshold that we're calling for, but they are very, very fragile health because of underlying health conditions. I would, just my concern for those folks. I think that they ought to have some way to make an appeal. I don't know how to do that, but I guess I'll just ask for that again. Since we're talking vaccines, I'll just keep bringing this up. That's all my comments. And I guess I'll make one final comment. I don't expect anybody to comment back on this one, but I did hear in the news today that I believe that the state of Kansas had 100,000 vaccines that were given that were not reported for some reason, which has given us a wrong spot, if you will, in the national rankings on different states. I don't know if that's true or not, but I hope that if the reporting is not happening correctly, obviously that's a state problem. But I would like to know that we're not last in the nation. So I hope that there's some more information that will come out of that. But that's all my comments and questions. Thank you for the time to speak.
Okay. Commissioner Dennis.
Thank you, Mr. Chairman. I'd like to speak to the vaccinations over at Intrust Bank Arena. Last week, I went over and toured both the drive-through and the Intrust Bank Arena, and I talked about that once before. But once they dropped the age limit down to 70, my wife then became eligible to get the vaccine, and I signed her up for the vaccine and accompanied her on Saturday. Every experience I've had at the Intrust Bank Arena has been positive. The staff over there is fantastic. The staff over at the drive-through is fantastic. I've received several emails. I forward those to the manager so that he can pass them on to the staff to let them know that how many people are very pleased with what's going on over at our vaccination locations. I talked to a number of people at both times that I was over there. One of the things, and I forwarded a comment to the manager about this, I ran onto Wichita, a fire captain that was on light duty. And they recommended that we look at and see if we do have other people that are qualified to give vaccines that are on light duty that we can send over to help volunteer with that. So I hope that you're looking into that. I've received phone calls with very positive response to what's going on over with our vaccination. So I just want to congratulate the volunteers, every single one of them that I spoke to, and every person I passed by I talked to. Was a very positive experience, and I appreciate it. Thank you, Mr. Chairman. I appreciate the opportunity to provide those comments.
Okay, yeah. Commissioner Lopez?
Thank you. Well, one thing I wanted to just kind of piggyback off of Commissioner Howell and say that, hopefully we'll be able to hear something from Dr. Mins at some point soon on those with comorbidities that are under 65 that would, be at a higher risk than, the age qualifications there. So hopefully we can see something about that relatively soon. But, okay. So I almost forgot what I was going to say, but my frustrations, as I'm sure many frustrations of people on this call are, we just need to get more answers from the state. And I know, Tom, we've been trying to get a meeting with Marcy, I hope that's right, with her last week, all week, to see, if we can just get some of our questions answered. It seems like we don't even have the chance to ask our questions, much less get responses to them, which I think is part of the problem, because we are receiving all kinds of messages and calls and emails wanting information, but we can only give them what we have. And I guess my frustration is, why are we not able to have these calls with the state, that the people that are running this? Why can't we ask questions? Why are we not getting answers? And what can we do to ensure that that's changing moving forward? Because last week we heard they were getting 80,000 doses. When I looked at the dashboard that they put out and counted up all the doses that they were sending to counties, it was only about half of that. So now I guess it makes more sense if they're only getting 40,000 that would be a little bit more even. But we should be able to ask these questions. And we're the second largest county in the district. We make up 18% of the state, and we can't even ask questions. So I think, I know it's frustrating, it's overwhelming for everyone, but I just don't think that's acceptable that, as Sedgwick County, we can't ask questions to our state partners as to what's going on and why it's going on and what we can do to help. I know that when we did have a meeting, she kind of hit on some of those things with, being 18% and said that Sedgwick County was having problems when it came to reporting our vaccines. I know that you guys have clarified that that's not a Sedgwick County Health Department. That could be a problem either with clinics that have given their doses, or even at the state level, just getting that reported in correctly. But I just want to know where the problem is, and I want to know why we can't work with our state partners a little bit better to get a better understanding of where we are. And, I don't care how we got here, but I just want to say, starting today, moving forward, what can we do as the Sedgwick County Health Department to help in any way that we can to make sure that we are getting more vaccine doses and that we are able to get those out?
Commissioner Lopez, those are good questions. And it is true, we all worked together last week to try to facilitate communications with the state, and it's been somewhat frustrating. On the comorbid issue, and I'm going to look to Seth or Tim to follow up with this. Just reminding commissioners, as we did a week or so ago, that population of people in the current CDC plan, there are phase 3 people. So Dr. Mins, early on, 2 or 3 weeks ago, when we began to talk with him about this, indicated that he felt like he needed to talk to the state. that he needed to talk to KDHE to, if we were going to veer off of the scheduled phase 2 and go to a population that was in phase 3, he felt like he needed input from the state. Now, Seth or Tim can correct me if I'm wrong, but I believe he asked that question of the state and was told no. Now, that doesn't mean the discussion is over or that we can't continue to talk about that. But that's just some of the problematic dialogue that we're having with the state right now. And we'll continue to, they're trying to serve 105 counties, I understand, and Sedgwick is but one of them. And sometimes I think that it's just a feeling I get that the urban counties, it's a different animal here than the rural counties, of which most of the state is made up of. Our operations and logistics are far more complex. We have, of course, 10 times, 15 times, 20 times the populations of these other counties. And it just, what's frustrating to me is when I hear from people, and I'm sure you do too, where people are able to go to other counties and get vaccinated where they can't get it in Sedgwick. It seems like the other counties they're looking for people to vaccinate. And here we're looking for vaccine to give to people to vaccinate. It's very frustrating. I have an email into Dr. Nielsen. I put it in whatever day we did the press conference or the KAC conference last week that we all took part in. I have not gotten a reply from her yet. I'll continue to try to do that. And I know she's busy and juggling a lot of balls as well. But, this has been a challenge all during COVID, not just during vaccination part. We had a lot of issues with testing, a lot of issues with PPE supply, a lot of issues with orders and instruction. And it seems like this communication has been tough the entire time. But I think we all have to understand that everybody's working very hard at all levels, and we should try to diplomatically continue to try to talk with them and get our questions answered, but at the same time understand that they're trying to do a lot as well. So we'll continue to try. Commissioner Lopez and Commissioner Howell, to your point on comorbids, and I don't know if Tim or Seth want to jump in on that. We'll continue that discussion, but it's in addition to just the difficulty of managing that, it doesn't seem like we're getting much of a green light from the state to deviate out of phase 2. And Tim, do you want to talk on that?
Just briefly, I will tell you, we agree that is a population that we really are interested in serving. We hear the commission, they're interested in making sure that population gets served as well. And so we've had staff level discussions about the possibility of reconfiguring phase 2 and 3 and moving that population into phase 2. But again, that's been at a staff level. We did not get a positive response of it. There's a recognition at the statewide level. I think that there are those concerns out there. They didn't appear to be ready to help us with that move. And so, from my belief, we need to have Dr. Mins have a Dr. Mins to Dr. Norman discussion about that. At this point, we need to move it beyond the staff level discussion and have our medical director talk to the state's medical director about the appropriateness of that. And then we've got to figure out the logistics with the medical community, how to make that happen.
Well, I appreciate you guys looking into that a little bit more. And I hope my comments aren't misconstrued. I know everybody's working as hard as they can at every level. I guess my biggest frustration is just I hear from so many different people what a problem might be. And maybe this is why we're not getting it. Maybe this, but no real concrete answers as to, is this an HL7 interface problem? Like, have we really given more vaccine than what is showing up because of IT issues? If that's the case, how are we working through those? Are we working through those with, the vendors? I know Epic had an issue. Who else are we working through some of those problems with? And then really, if, some of our community members or people that we're giving those doses to, or some that had received some from federal levels, if they're having a hard time getting some of this, input, I would hate if some, a different clinic who has nothing to do with the health department, if they're having troubles getting stuff put in the right way, that we would be penalized for that. So, and I don't want to, like I said, I don't think there needs to be blame anywhere, but if Sedgwick County can help some of our community partners, or we just need to know where the problem is so we can fix it. I mean, I know we're all frustrated. I know this has been a long year and everybody's doing, the best that their ability, but I think we just need to get looped in on what some of the problems are so we can go from there and help fix them. Thank you.
I'd like to make a couple of comments as well.
All right, go ahead.
I don't want to miss my opportunity also just to say, piggyback off what Commissioner Dennis said earlier, that is the staff that's down at the Intrust Bank Arena, they're doing a tremendous job. They're very professional, they're very kind, and I know they're doing exactly what they've been asked to do. And I want to say, number one, I appreciate their great work. I've heard nothing but good things about the staff down there. So I want to make sure that everyone understands that I'm not complaining in any way about the staff. I'm just concerned about the folks that are in the line in the wrong place and having to deal with the cold weather issues and that type of thing. I do want to make a comment regarding the comorbidities issue. I just went on KDHE's website to take a look for the vaccination plan, and it refers me right to CDC. And CDC did put out, again, I don't know why they're using different numbers and letters than we are, but what the CDC put out, they actually equate, if you will, people aged 65 to 74, because they're high risk of hospitalization, illness, and death from COVID-19. People aged 65 to 74 who are residents of long-term care facilities, but right along with that, equal with that, is people ages 16 to 64 with underlying medical conditions, which increase the risk of serious life-threatening complications from COVID-19. Then they have a more detailed report. If you want to click on, there's a link there. It goes into very, very huge detail about exactly what they're talking about here. I would say I get more questions about this than anything else. If I was going to quantify the questions I get from my constituents, the one thing they don't understand is, it seems like we're following age only, and we're not looking at the issue of who's at the highest risk of COVID-19. And I think that age is a factor, but it's not the only factor. And I know that I know there's probably some fear of subjective rules that you might say someone's qualified and someone else isn't qualified, and there may be some fear of that. But I think we all know that when someone is dealing with stage 4 cancer, they're going through chemotherapy and radiation, or someone has organ failure, for example, or they have unmanaged diabetes that's causing them to have they're losing their limbs and their eyesight. There are reasons why they should be given a chance to get this vaccine a little bit early. And I understand that we have our plan, and we can refer back to the state, but the state actually refers back to CDC, who has these allowances built into it. So I don't understand why the state would tell us no. And by the way, I also thought the state said that the counties actually have an opportunity to develop our own strategy in the county, which again, I think is why we see other counties like Reno County doing this much differently than what we are here in Sedgwick County. So obviously we're allowed to do that. I don't understand why we would say the state is the reason why we can't get into this issue of considering comorbidities of people who are have extremely fragile health.
Okay, thanks for all the comments. Hey, Seth, can I ask a question? Then I got a kind of a closing comment, because we do have Akeem wants to update us on the press conference that Evergy just had. He's got some pretty good information that he just shared. But Seth, historically meaning the last 3 or 4 weeks, things changed so fast, but my communication with the state was that there was going to be trying to give a couple weeks notice and kind of a consistency, which actually did happen. We were getting about 7,000 vaccines a week. We kind of knew it was coming that way. And then as an example, it's been referenced, then all of a sudden the state thought that they were going to get maybe double their doses. And do you feel that I think it was very beneficial for our group and our staff and planning and our department to have that a little bit of advance notice, or what's in the future, knowing that it can change. I realize that. Could you just comment, do you feel like the state's able to continue at that, or is it kind of in a state of flux?
I think there was some hope that an indication from the CDC that they would be letting us know, or letting the state know several weeks in advance, and then thus the state being able to let the counties know several weeks in advance. maybe again, not exact numbers, but again, a X percentage increase. That was mentioned, I believe, last week, and I don't think it's happened as of yet. So I know that at the federal level that's their intention, or that's what they've stated as their intention, and therefore, hopefully, we'll see that in the next couple of weeks. And that would definitely help us in terms of being able to open up the appropriate number of appointments, being able to redistribute and transfer to our partners and plan that, several weeks in advance. So it's not this quick, we've got to move like we've had to do on these one-off allocations each week. So yes, we do hope to see that improved in the future.
Well, I
I
think
do have another. Oh, go ahead. Sorry.
Well, I just think that would, that we did have about a 3-week period where we had some calm in this. I think today you're witnessing that it's rather stormy. I was almost going to rename the staff meeting the beat up staff meeting going forward from today. But with that, it did add, I just historically, the last 3 weeks was a more steady flow and a steady communication. And now you can see the frustration is when we don't know, then it peels off to the staff when maybe a lot of this was directed at the state for answers. So anything you can help with, and I know that there's a few people up in Topeka that really were pushing towards some kind of an advanced messaging that was provided that atmosphere. So anything that you can assist with in your state position or your state consulting position would be helpful. And then we're going to say something else.
Absolutely, I'll take those notes back, and we'll see what I can do on my end. I do want to just clarify on one question that Commissioner Howell asked about the providers being able to allocate outside of what the health department's level or numbers, groups within the population that we're currently serving. So the only exception to that would be that federal pharmacy program. Their directive is to follow the state. So we have reached out to them. We've had conversations with them that we would like for them to follow the county guidelines. And for those that elect to receive allocations from the county, that is the intention. If they don't want to receive that and they just want to have their allocation coming to them from that federal pipeline, they will only have to follow what the state recommendations are. And so that would be phase 2. So you could see providers as soon as this week offering vaccine outside of what the county is saying. So I just wanted to clarify that because you could start seeing that.
Well, Seth, let me comment on that, because I know people last week that are far outside any guidelines for the state or the county that have gone to pharmacies in our community and have gotten the vaccine last week. So I don't know what's going on there, but there's some inconsistency in these rules, and there's evidence of this. So I don't know what to do how to answer that, but it is causing problems when some people out there are trying to get this vaccine and they're frustrated, and then they find out someone else in the neighborhood has already got it, and they're 40 years old and have no qualifiers. That's a problem for us as policymakers and as commissioners of this community. I don't know how to answer those questions, but it's happening already.
And I will say that is out of control of the state. I mean, that is a federal. The federal has said that if as the contract that they have with those providers, that they have to follow the state's guidelines. I think we do have most of our pharmacies have indicated that they do want to stick with the community and follow what the community is, just to help themselves, for the exact point that you mentioned, that it is going to cause confusion and cause issues. And so they don't want to come in and be they don't want to cause another issue. They want to be part of the solution. But what I just wanted to level set to make everybody is that at the local level, we do not have control over all of those providers who are receiving that direct federal allocation. And the state doesn't have any direct role in making them follow those local regulations.
I'll go ahead and comment on that too. If you just watch around the country with what's going on with vaccinations, it is all over the board. There are disasters in progress out there right now. The county's goal from the very first vaccination was to run an orderly, efficient, fair system for the people of this county. And we're sticking to that. We're trying to schedule people so we don't have hours long lines and jams of people waiting to get in with this first come first serve mentality. As Tim mentioned, if you have an appointment, we have a vaccine for you. You can rest assured of that. As we roll through, and remember, there's millions of doses of vaccine going out across the country, and the usual suspects always arise. People that are trying to fool the system, people that will go in and lie, people that will go in and try to buy up or acquire through the use of money or power vaccines. It's happening, and we're going to try to avoid that in this scenario with a fair and equitable process. And is it going to be flawless? Absolutely not. You're going to get people that are going to go in and do whatever they can to try to get a vaccine ahead of elderly or sick people or comorbid people, all the people we're talking about here who are at highest risk of this virus. And we're going to keep our face forward. We're going to keep our North Star the same. We're going to continue to try to do this fairly, equitably, and reasonably. And when those cases, when we hear about them, we're just going to plow right over. That's not going to be how this county is going to manage this vaccine. We're going to do it through fairness and equity and discussion like we're having today, hearing from our elected body on what their desires are. We'll convey that to Dr. Menz, and we will do the best we can to roll out these vaccines fairly. So I don't know how else to address that issue.
Tom, I appreciate your comments on this. I just wanted to highlight the fact that I don't think when this happens, I don't think someone is doing something unethical to get into that line. So I'm not accusing someone of doing that, but it just sounds to me like the pharmacies may have other rules for whatever reason. Again, I think Dr. Menz is aware of it. If someone at the state becomes aware of it, maybe they can, I guess, rein in that pharmacy to follow follow at least state rules. But this is already happening. And I'll just tell you, when it does happen, it causes a tremendous amount of frustration amongst the people out there that are trying to get their shot, and they find out this is happening. It just causes a lot of frustration. And the fact that I know that it's already happening it really bothers me. And I know that as long as you guys are aware of it and we can maybe talk to the state and talk to Dr. Menz, I'm satisfied with that answer for now. But I just want everyone to understand it already is a problem. It's not something that we expect next week or the week after. It's already happening.
Okay. My personal experience has been that every time I had a phone call with a problem or a question, I've asked them to please email me, and I have forwarded those emails, the dozens of so that I get to the appropriate to the staff, and I've seen immediate response in addressing those. So I would encourage any commissioner that has an instance that they believe is warranted or factual, that they get it in facts. And I think my experience as staff has been immediately responsive to any query that I sent to them. And of course, I don't want to overwhelm them, but if it's something I can't answer, I get it to them and they've responded appropriately. So I'd encourage commissioners, if you get those phone calls or rumors or whatever they are, and if they're factual, get it in writing and get it to us so they can respond and address. I'd like to, my final comment is that, again, this has been it's an ever-changing environment. I'm sorry that it's not stable enough for our commission to have a better feel about it. But Lord knows we were supposedly officially a government holiday yesterday, which was far from a government holiday when 8 o'clock in the morning, I'm getting a call from Evergy bosses saying they're going to start closing down 30 minutes at a pop. And so what does that do? That, we have to, what's the impact to us? Well, obviously, Tom and the staff had to jump through hoops to assure that Elora over at 911 was ready for all the calls they're going to get. The operating group, none of this had anything to do with COVID. So on top of all of the frustration and even anger that some of the commissioners are extending towards staff. Something like a once in a lifetime shutting down 30 minutes at a time and making sure that our support services through our staff is still functioning. The biggest one being 911 was not an easy 3, 4, 5 hours we went through yesterday, Tom and your support group. So that's just another example of how crazy this world is right now with stuff. So and it wasn't even us. We're part of 13 states. It was getting told by a federal group of 13 state conglomerate what to do and not to do. And so we had no control over what neighborhood was going to get 30 minutes shut down or not, if it was going to be more than that or not. And so maybe we can take some of those lessons learned and know that we maybe, as Commissioner Lopez said, maybe we just try to help manage what we can and try to help the state get better. And if we've got influence at the federal level, then good for some of you if you have that influence. But that would be my, I want to just thank, and I think the group at Interest Arena is doing fantastic. Sorry if some have to stand in line a little longer than they have. When that's happened, our staff has admitted that we had a complication, a problem, and they've corrected it even the same day or within the hours. So I've had nothing but, I've had some great compliments from people that have been over at Interest Arena. So let's hope that that can continue and then the partners, the pharmacies and the partners can not only get the vaccinations out, but please, we need to appeal to them to make sure they fill out the paperwork and get it reported as quickly as possible to the state for reporting purposes, as was discussed earlier. So without further ado, Akeem, are you available?
I am, Chairman. Good morning.
Can you summarize us with what the Evergy press conference was about, please?
You bet, Chairman. Just about 30 minutes ago at 9 o'clock, Mr. Chuck Casely, who's an Evergy representative, he gave an update to news media and to other departments on kind of the Evergy power outage. And right now they're calling it a temporary emergency electrical outage. From Evergy's standpoint, Evergy will continue to ask customers to conserve energy into tomorrow evening, as has been noted on today's meeting. The temperature is starting to rise a little bit, but the demand still is really high. And so I'll get into that here in a little bit. The number of people who have been affected so far, Evergy says that it serves about 1.7 million customers. Of those customers, about 170,000 people have had controlled outages at this point. Evergy says if the cold does continue, as many as about 25% of that 1.7 million customers could be affected. The peak demand is really kind of the issue here. Peak demand right now is from about 9 a.m. until 10 a.m. In the morning. Evergy says it's almost impossible to alert customers. So a lot of folks are asking, when can I be alerted that a power outage is going to happen? Evergy says it's really impossible because they're working through so many different avenues to try to keep the supply and the grid still intact. But if you do experience a power outage, after about 60 to 90 minutes, Evergy says, please give customer care a call, customer service a call. That number is 1-800-383-1183. And you're able to talk with a representative to kind of understand when your power could possibly come back on. For our hospitals and our healthcare partners, Evergy is trying to eliminate hospitals and COVID-19 vaccine storage sites, but says there are a lot of moving pieces that may happen quickly. So Kansas is part of a Southwest power pool, which is made up of about 17 states. At this point, they're trying to avoid the situation that many of us are seeing on the news that is happening in Texas, where there are about 4 to 5 million people without power still to this day in this hour. The whole point of this is to conserve power so that's why they're having these temporary power outages, to basically cut off the grid. And how Mr. Casely explained it to the entire group is you've got a plate and you've got a pencil. And so if the plate gets off balance because the demand is so high that Evergy can't supply that demand, then it kind of off tilts the power grid. So by having these temporary power outages, it allows that grid to basically stay stable and not overloaded. There are benefits and disadvantages of Kansas being part of that 17-state power pool. One of the things is that it is more stable because you have so many different groups on this one power grid, and it allows Kansas more access to electricity. And it ultimately makes it a lot cheaper because you have so many customers on that one power grid. Mr. Casely said 99 out of 100 days, the system works well. Then you have that one day out of 100 days that it doesn't quite work well, and you kind of get it off balance. Let's see. Evergy says the grid stability from the Southwest Power Measurement is required at this time. So they're being told to have these temporary power outages, not that they're electing to do so, but as an overall power pool, they're having to do so. The real problem right now is that Evergy is having a problem with securing natural gas. So the natural gas is kind of the real problem here. So it's made up of a couple of different energy sources: natural gas, coal, wind power. Coal plants are doing well for the Evergy system right now, but there are some issues with storage. They're stored outside and it's cold. So they're having some issues with that, but overall coal is actually doing well. Wind power typically makes up 30 to 35% on a normal day. These last couple of days, it's only made up about 18% of the power for Evergy. So those turbines, those wind turbines, are really having a hard time kicking on and staying and producing that power that we need. So the cold winds are really kind of hindering that. So again, after 60 to 90 minutes, if your power still hasn't come on, you're asked to call Evergy customer service at 1-800-383-1183. But these power outages, if temperatures continue to stay cold, will happen over the next couple of days. But Evergy says that it will not hit a person. So if a home has been down without power, they're going to try. Basically, you go to the end of the list and you'll try not to get your power out again. They'll try not to turn your power off again, but there's no guarantee. So that could happen again. So I know that's a question that many people also have. Chairman, if you have other questions, I can definitely answer those, but that is kind of the overview. Evergy will post this on social media, and we will share. I'll have my team share this on our social media pages. We did encounter some issues towards the end because one of the questions was what happens with those folks who are on the medical equipment list. So if you've got a medical device at home, power being off. So they're going to answer those questions because they had some issues with their live on their social media channel. We'll be sure to share that on ours as well in Sedgwick County.
All right, thanks. How long was that press conference, Akeem?
It lasted about 50 minutes, about 45, 50 minutes. It was scheduled for an hour.
Akeem?
Yeah, can you hear me, Chairman?
Yep. How long was the press conference?
It lasted about 45, 50 minutes, but then it got cut off at the end because there's some technical issues.
Okay, so you're going to post that so we can, that the community can rewatch if they want to?
Yes, sir.
Okay. And I know that Westar locally here, Evergy has been available to talk to Tom, and I think they've been in communication directly with the city manager and as well. So if you got any other questions, I think we could feed them towards Tom, and Tom, you can get them over to
Chairman Don Sherman has been doing a really good
Evergy.
job. Don Sherman's been doing a really good job of putting information. So we have plenty of communication with Energy. I'll just add, since we're on the topic here, that Alora just sent, Alora is our 911 director, just sent Rusty and I an email giving us a heads up that she is asking emergency management to ask the Salvation Army to start up warming stations. 911 has gotten calls from several areas of town that have been without power for up to 3 hours now. And we're beginning to get check the welfare types of 911 calls, which will, of course, stress our police and fire resources, elderly people, young children. So just a heads up on that. And we'll, as soon as we hang up here, I'll get a hold of Dawn and see. That seems like too long of a delay for if it's a rolling blackout issue. That was supposed to be a 30 to 60 minute event, so I'll try to get some clarity on that. I would think a message for people is that if you were out over an hour, you should definitely call and inquire and see if they can't get somebody out to get you up and running. But Alora, according to Alora, we're getting some reports that some places have been out for hours. So that's the latest information we have from 911.
Okay. Thanks, Tom. Thanks, Akeem, for the update. And anybody else got any comments? Seth, did you
Chairman,
have your-
before
Okay.
sorry, Commissioner, a little bit.
Go ahead.
Before we quit, I did want Adrian to just talk about the UK strain, because that made the news yesterday that we have a case here. And I had a little bit of conversation with Dr. Antonios at Via Christi yesterday about that. So Adrian, could you bring us, and you're muted, but could you talk about what is happening with that?
Yes. And so it's not unusual for viruses. I mean, all viruses mutate and change. And so this wasn't a surprise. There is a UK variant and also a South Africa variant. So far, all the studies that they've done have shown that the current vaccines that we have, the Moderna and the Pfizer, our antibodies respond well to that. So it shows that those vaccines do protect us from that variant.
In my conversation very briefly with Dr. Antonios yesterday, he just wanted the message put out that it appears to be more highly contagious. There are some very early studies that it may be a little bit more serious, but way too early to tell on that. He was emphatic about that. He also just said what Adrian said, is the vaccine seemed to be effective against it, or if you've had COVID before, your antibodies seem to be effective against it. He wanted to stress that masking was still very critical. Distancing was very critical. Washing of hands, all of the things we should really be getting good at. We've been doing it a year now. He really wanted that emphasized, that we should, now since we have the strain here in the county, that everybody should just maintain their healthy practices. And let us get some more of the population vaccinated over the next several weeks and months. And that was his message he wanted to put out today, and I told him I would do that. So now, Chairman, it's back to you.
Does anybody else have anything? Seth, did you have your hand up or just, no? Okay.
I think
Anybody else have any comments?
Real quick, Akeem, when you post that stuff from Evergy, can you make sure that the number's on there to call if say someone's house is without power for an hour? Can we make sure that there's an appropriate number for people to call to report that?
Absolutely, Commissioner.
Okay. I real quick also wanted to just thank everybody. I mean, I know we've heard a lot of frustrations on this call around COVID and vaccines and everything else, but the staff at Sedgwick County has been just going above and beyond to adapt to every situation and as it's coming. And I want to make sure that you guys realize that, we see everything that you're doing and we really appreciate you. So thank you so much for everything you're doing and continuing to do. We need it and we appreciate you. Thank you.
Okay, I think that's everybody. And so we will adjourn this and we will have our regular meeting tomorrow morning, Wednesday at 9 o'clock. Thank you all for joining. And be part.